passed all 6 of these easy tests, 33% of the boys and girls, the third grade, could pass the test. And it went down every year until less than 10% of the seniors could pass the test. We had a man from the Pentagon in, 2-star general. He said, that's a matter of national security because these young men, women, graduating from high school, they're so fat, they're so deconditioned, they can't meet our standards, and then we had to lower our standards to meet our quotas. We got 6 weeks of training in 3 months. They're in Afghanistan and Iraq. Poorly conditioned, a matter of national security. We're changing that. The superintendents, the teachers and all, they were very much against our program, what we were doing. They found that with such horrible statistics, made it mandatory. We started making a change back in 2008, but they thought, oh, well, this is interesting. Can you correlate, Dr. Cooper, with all the data we have in our repository, the Texas Education Agency, can you correlate major levels of fitness with these things? Number one was absenteeism from school. Why they want that? Because the schools get paid by the number of days the kids are in school. In our press conference last March, Rick Perry said that if we could reduce absenteeism by 10% in all of our schools in Texas, we'd be rewarded $217 million in the government. I didn't realize that. Number two, they want to know about violence and gangs and drugs related to fitness. And number three, grades. That's the order they wanted. Went back and looked at our database, 2.6 million kids. And what did we find? Those kids who passed all 6 of the tests, they scored the highest academically, had the least absenteeism, and absolutely no drug problems. Very, very rare. Other extreme, just the reverse. Undeniable data. There's a change in attitude as people get involved in these conditioning training programs. So on and on. It's been a delight and a pleasure to see how these things are going. And we said we started our testing again in 2009. Even the critics said it was a big thing. In 2008, you'd be likely to get half the schools to respond. We tested 2.6 million kids. In 2008, we tested 2.9 million kids in 2009. What's happening now? We've got at least 10 states trying to follow what we're doing in Texas. We've got foreign countries involved, what we're trying to do in Texas. And I'm happy to announce, it hasn't been announced yet. You heard that this weekend, or at least by the first week in December, that the NFL is going to be sponsoring fitnessgram testing nationally for the next 3 years. They're paying for it to do that. So we'll get this thing spread nationally and get this thing going. And that'll be announced this weekend, be announced, but it's in combination with their Play 60 program. NFL has taken the 35 cities, Denver will be one of those, and authorized those teams to have, it's 32 cities, to have 35 organizations in your community, YMCAs, whatever it may be, that will initiate the testing to the program and then reevaluate. And you'll see probably in 2012 at Super Bowl, the state, the city that does a great job, best job, will be awarded something at the Super Bowl in 2012. It's a great plan. Because I've thought for years, if you want to get success and changes in people's lifestyle, you have to educate. You have to evaluate first. You have to educate, motivate second. You have to give people recommendations how to change their program to safe, effective, and realistic. And number 4, reevaluate. That's what we've done at our center in Dallas for the last 40 years almost with 110,000 patients. We get the greatest results in America. The patients come through our clinic. They're motivated to do what I'm telling you because we know that 21st century medicine includes these things: proper weight, proper nutrition, proper supplementation, proper exercise. It doesn't take that much. Proper weight, body mass index, less than 25. Proper exercise, 30 minutes of activity most days per week, collectively. We know that. Proper nutrition, 5 is fine, 9 is divine. Number of servings of fruits and vegetables should be consuming daily. Proper supplementation, 2 of the hottest things in the field now are vitamin A and omega-3, vitamin D rather, and omega-3, 2 hottest things. We measure that in all of our patients. I come into our clinic in Dallas. You ladies worry about osteoporosis. You're not going to have a problem if you have adequate vitamin D in your blood. You take all the calcium you want, it's not going to do you a darn bit of good unless you have enough vitamin D. And we find that 71% of American adults are deficient in vitamin D as measured by blood samples. NIH is now sponsoring a 20,000 person program up at Harvard School of Public Health. Look at the long-term effects of vitamin D supplementation and omega-3 fish oil. There are 17 different cancers that can be related to vitamin D deficiencies. The cancer of the colon, cancer of the breast, cancer of prostate, cancer of the ovary, and cancer of the kidney. We find 91% of Afro-Americans are deficient in vitamin D. And Afro-Americans have twice the incidence of breast cancer and prostate cancer than the Caucasians. Interesting, isn't it? Omega-3, used to control cardiac arrhythmias. It's brain food. If you want to prevent Alzheimer's disease, do these things. Number 1, exercise your mind daily. Number 2, get at least 30 minutes collective activity most days per week. Number 3, socialize. Number 4, get 7 hours of sleep per night. And number 5, take at least a gram of omega-3 fish oil capsules daily. Strong recommendations now. 21st century medicine. But finally, I want to leave you with an interesting study that we did in Dallas. It's called the Cooper High School Program. It's done with the Dallas Independent School District because we saw these dramatic changes that we had in Texas with these students, and we saw some tremendous improvements in schools once these kids got involved in the program. But the biggest thing we saw was the change in attitude. So I saw this in Dallas, DISD, Dallas Independent School District. So I asked Superintendent Hinosa, I want you to give me 40 kids, 20 boys, 20 girls, who are seniors, but barely made it to the senior year because of academic achievements and physical fitness. They flunked the fitness gram test. I want those that have drug problems. I want those who have gang problems. I want those who have discipline problems. I want the worst kids you can give me. He gave me what I want. In fact, when they came out, 20 boys on Tuesdays and Thursdays and 20 girls on Mondays and Wednesdays for a 75-minute boot camp that's supervised by my staff, I shook hands with them that first day, and I went back and washed my hands. I mean, they had the long earrings, they had the spike, they had everything. I got just what I wanted. So we put them in the boot camp for 10 weeks, starting last September. We finished up December the 31st last year. And it was 75 minutes starting from 5 until 6:15. We bust them out. I paid for this project myself. It cost me $25,000 to do this. At the end of 10 weeks, these kids, worst kids you can find, they had a 70% improvement in their fitness as measured by the fitness gram. After school program, twice a week, 70% improvement in these tests. But the most dramatic thing was the attitude change. These were comments made by December the 31st last year. Do we get to keep coming after December? I need this program for my life. I don't know if yet how to do this on my own. These are gang kids. Without you guys, I might end up a dead ditch somewhere. But now I'm getting healthy and I'm taking care of myself. Can we bring friends to join the program next semester? I have some people who would like to come. Would like more nutritional information. These are high school seniors. How can I eat healthy when I have to eat my mom buys? I need to learn ways to make a healthy choice. Please let us come back in January. Maybe we'll do a push-up until now. I think it's fun, like working with people. I like this one, the last one. We're on this journey together. We won't let each other fail. This experience is going to make us friends for life. We're going to get healthy together. We've made a bond that will never go away. 10 weeks. Attitude change. 3 million kids in Texas. What happened across the state, across the country? Colorado. What happened? We've got a wonderful thing to work with here. But the thing we have to realize that, it says in the Bible, we're beautifully and wonderfully made. In Genesis, it lasts us 120 years. Our body should last us. We find our studies in Dallas. Men been coming to us for 20 years or longer and coming in regularly for the examinations, doing what we request. Our projected life expectancy is 87.5 years. Our women, 90.5. If you practice what I'm talking about today, you might be surprised to see what happens as far as how long you live and the quality of your life. So my goal for all of you is to pay attention to what I said today. Concentrate on your people first, yourself first. Concentrate on your kids, your grandkids. And let's see if we can't change America starting today. Thank you very much for your attention.
Thank you. Thank you, Dr. Cooper. We're so honored that you came and shared that with us. The results speak for themselves. I mean, what you've done is outstanding, and we certainly appreciate you sharing that with us.